our office so we can give you the information on that. And then once the video is done, we're going to go over how to use that form of communication, and along with some other stuff that we do in the office as well for that.
And because I just turned the recorder on and I missed everything, let's start again. Is that okay? So let's do it briefly. Yes, we're going to be going to, we're having our two-day conference that will be in New Jersey on New Jersey, June 22nd, 23rd.
Yes.
And Chicago first on June 8th and 9th.
Yes.
And all of the people that we work with will be there, those people who are responsible for getting our practice where it is. So we hope we'll be there. And we anticipate a great meeting with all of you. And now today we're going to talk about communication. Yes.
Now communication. Yes. Now this short video first, like I said, it's only about 6.5 minutes or so. And once the video is done, we're going to go over how to use that along with some other methods of written communication that we use.
Written communication is so important. There are things that a staff member can identify, or a staff member who wants something that can look at that particular thing and identify it, and then perhaps come up with a solution for that. After all, I don't think I know a thing about what goes on in sterilization. Yeah, I bought the sterilizer at one time, and I probably came up with a policy 20 years ago on how it should be, how sterilization should be done. But since that time, I don't even know how to turn on the sterilizer. So how am I going to be able to help to determine what can be done in sterilization that might be better than what's going on right now? Well, it's the person who's right in that area who can determine what might be better, what might be more efficient, what might be better for the patient. She can come up with those suggestions, or actually those policy changes, a lot better than I can. But it's important that she develop it, but then she sends it on up to a manager type of person in order to approve it. Well, that's all done by a form called CSW. C standing for completed, S staff, W work. In other words, all of the thinking is done by the staff member on what the problem is, what the data is that supports that problem, and what the solution is to that problem. That's all done in writing before it goes up to the staff member. A heck of a lot better than saying, hey, I got a problem, can you fix it for me? That's not going to work at all. We want the staff member to take full responsibility for the area. So how do you use the CSW?
Well, CSWs can be used for any kind of request. It can be used for requested time off, requested hours off, days off, weeks off. It can be requested to order something. It can be requested for change of policy. Like Dr. Sheldon said, the best person to know a better change in policy for a department is the person who's working it, and they may have a really good idea. So we don't encourage staff to stick within the same old policies as when the practice first opened 30 years ago. It's always find a way to make your area more efficient, to make it more productive, to make it run better. And so if they have an idea, we encourage that, and they write it in a CSW. So with the CSW, they put who it's to, so it goes to a supervisor or doctor, and it's from, the date, it has the data.
Has the problem first.
It's the problem first. So they write out what the problem is. It has the
data that supports the problem, that gives some idea.
Correct.
So
All the
that
information.
They're really clear as to what the problem is that staff member is facing.
Right. And then it has the solution. So for example, if a particular staff member works Tuesday through Friday, which one of our departments works Tuesday through Friday, and she has to leave for a wedding on a Friday, then her solution may be, the problem may be, I've got to go to a wedding, and I have to leave on a Friday. I have to fly out, so I cannot work that Friday. The data in that may be information involved within that, and the solution may be, why don't we work that department Monday through Thursday and have Friday our day off, so that we don't lose production and we can work a full productive week. So she just solved the entire problem for me. I don't have to do anything but approve it or disapprove it. And so since she's found a really good solution that does not hurt anything, I would go on ahead and approve it. So that works out great for them, thinking through it, not taking my time to say, okay, how am I going to make this work for her, for everybody else? She's already asked everybody if it was okay, and she's gotten approval from everybody in her department. She's just letting you know she's got it handled.
Good, and that's why the words "this is okay" is so important. It means that all of the thinking has been done. Not, is this okay? It's the staff member making the decision and doing all the work to say that this is okay. Signature, and then it goes to one of us, and as Danielle says, it's either approved and writing, and then that goes right back to the staff member who submitted the CSW, or disapproved. And when it's disapproved, you just don't disapprove it. You just don't say no and throw it back to the staff member. What's the staff member supposed to do? Not go to the wedding? So it's disapproved because perhaps the solution wasn't the best solution. And so when it's disapproved, it's what, it would be disapproved by Danielle, and Danielle would say, what about this or what about that? Could we do it this way? Could we do it that way? Then it's going back to the staff member for her to approve it and for her to rewrite the CSW, or perhaps just say yes, submit the CSW back to Danielle saying, yes, this is an acceptable solution for me, and then it's all handled.
And there's a lot of times that we kick those forms back and forth. When I get those forms, the majority of the time they're very detailed and they have really good solutions, but sometimes it doesn't work for us. So sometimes I'll kick it back and I'll say, okay, well, this appointment you have for this doctor in the middle of Wednesday is not going to work out for any of us. How about, do they have openings on Friday? How about, do they have an opening last thing in the day? That way you can, work through your lunch and leave a little bit early. So I'll offer another solution to them to say, hey, how about this? Would these solutions work? And maybe they'll kick it back to me and say, well, they don't see patients on Fridays. They only see those particular appointments in the morning. So we're working through those. But a really important part on that is this is written communication. I don't have to get that form out of my box until I'm ready to handle that situation and work on that situation. All the other stuff is happening first. I'm getting through my day. So that does help out quite a bit. So it's written, it's when I'm ready for it, and I don't have to do a whole lot of thinking. It's just either it works really well, or what about these possible solutions instead? And we keep kicking it back and forth.
Good. So use CSWs. You'll find that it'll make things much more efficient for you, and it'll get your staff taking more responsibility for his or her individual area.
We hope you have enjoyed this video. If you have any questions in regards to it, please email us.
The American Association of Independent Periodontists is there to help every periodontal practice do better. I'm Dr. Lee Sheldon.
And I'm Danielle Joyner. We'll see you on the next video.
Okay, so that gives you an idea as to what written communication is all about. We're going to talk about simple principles tonight. Things that are so simple, but I can't tell you how profound and what a difference it makes in our practice when everything is done by written communication. Does that mean we don't talk to each other? No, we actually do talk to each other. But I've got to tell you, when Danielle and I are sitting next to each other, and we sit next to each other, our desks are next to each other, it's more often than not that we'll do written communication or email back and forth, so there's a written record as to what's going on, and so that I can receive that information when I'm ready to receive it. And I'm the worst offender because I'll bug Danielle when she's in the middle of something, and she's much more polite to me. Seriously, but if I send it when I'm thinking about it, and she can read it 5 minutes later when she can field the email she was already on and then get to my email, she's going to be less scattered. I mean, I'm the boss. She ignores me now. But a lot of your staff members don't have that privilege, at least not yet. But I can't tell you how important it is for written communication. So this is one thing. It's CSW.
Yes.
Completed staff work. The staff does all the work, okay?
Yes.
The staff shouldn't be asking you. The staff should be telling you, and it's based on the policy that you have in your office.
Right.
That's part of this is okay. It's your policy. So she's doing what she's supposed to do within policy. So she's done all the work. All you have to do is say yes or no. That's the best CSW you can possibly have. Not the one that goes back and forth, but the one where all the thinking is done, where all the data is there so that Danielle can think about it. Occasionally I get a CSW, or doesn't have to think about it, Or
Right.
if I get a CSW, I don't have to think about it. It's all there. I say yes, approved, and it's done.
Yes, I just had one today from our hygienist who wanted to take 2 trips that included 2 days out of the week. And for those of you that have hygiene in your practice, those are booked out 6, 8 months, 12 months in advance. So she has a very full schedule. She did follow the policy as far as at least a 30-day notice. Most of them give me more than that, which is good. But for a hygienist, that is not enough time. So hers was 3 months out, and her solution was that she had contacted another hygienist that works in our office that is a temp in our office, and found her to take her place during these times. So I didn't have to find anything to do with it. Hygiene is hard. I mean, if our hygienist can't be here, we don't have anything else to do but to not have hygiene that day. So it's good that she found that solution. She got that girl to say, yes, I'll work. She had it on the schedule. And if they can't find a temp, then they know that their solution would be, I have taken those patients from that day and I've moved to another day, and I've blocked off that day that I'm not going to be here. Those are solutions I'm looking for, because I don't have time to, as we said in the video, come up with those solutions. So I keep a copy of those CSWs. I give one back to the staff so that they have one for records, because there are some times that maybe I didn't complete my cycle of action and I forgot about it, didn't put on schedule, and I will question it and they'll say, here's my CSW, here's the approval that I had. So I discard those after the date, but I do keep those just in case. I also keep them for reference, because I keep them in the staff file on those. If they've asked for a lot of time off and it's not good and it's affecting the practice, I can refer back to those and say, okay, you've taken X amount of time off, or I can't approve this one because it's just too much. That's never happened before, but it's nice to at least have those for that reference. So these, as we said, we use them for time off. We use them for change of policy. We use them for a request for new uniforms, whatever it is, because sometimes even with the request of uniforms, if it's their fault of something where they have damaged their uniforms or whatever it is, then maybe they would have some solutions that would benefit us versus, okay, now we have to take responsibility for something. So I would recommend that you take that form, use it in your practice. They work wonderfully, wonderfully. But we also have other forms of communication. The biggest thing with this is it's written, it's acknowledged, and the staff is sharing it. So written communication is a big part of our practice. We have about 18 people working here all day long. We have most of them are girls. They love to talk about business, about personal, about stuff, and all this is being intermingled during the day. So if you try to ask somebody to help you with something, and then you go to a topic of your kids, and then your room, and then your patient, we just forget. By the time I get to my desk, I forgot. Yeah, sure, I'll help you. I'll do that. But before I get to my desk, I've talked to 4 or 5 different more people. I've ran into an emergency. I've done things. I forgot about it. So I will forget. You have those forgets, and you're going to have chaos in your practice. So written communication is key. Here is a form here of our.
This is called a dispatch. We
yes.
That's officially in the Hubbard management system. This is called a dispatch.
Yes, it's a written communication form that we use for all staff. The rule is, if it can wait, if it's not an emergency, if you don't have a patient in front of you, a patient on the phone, and this can wait, do written communication. It doesn't matter how simple it is, because we have things on our mind. We are working on emails, on phone. We have things that we're doing. If we have to stop to take on what someone else is saying, we lose it, or the quality drops, one or the other. So for these, the staff fills out these forms to whoever. From you, the date and time. Time is not as important if it doesn't have to do with a phone call. The front desk will use date and time. The clinical in the back at least uses the date. We have to have the date on there. It'll go for what it's regarding whatever they need, regarding an issue, whatever it may be, and then who it's. Just like a letter, dear whomever, I need to have this by the end of the day. I need to be shown how to do this. I'm not sure what this is. Can you please show me when you have time? And then they sign it. They put it into my communication box. I get that when I'm ready. I don't get it right when they need it. I get it when I'm ready. So I'm able to answer it and give it back to them. So with communication, it's written, it gets to the person. I have to acknowledge, even if there's no answer to give. I have to say, okay, I got it, no problem, whatever it is, and give it back to them so that they know it's been handled on there. So that's the biggest part of
And
that.
it doesn't actually go to them. We're going to show you how we handle this.
Yes.
So here's an example. I'm sending something to Danielle. So our DMJ, her initials, underneath that are my initials, today's date, May 2nd, 2018. Regarding IDS meeting tonight, dear Danielle, for tonight's webinar, can you give me some photos of what we're discussing? Thanks, Lee. And that's essentially what happened today, by the way.
And that arrow is on there. It's a true arrow. We're not just using that for
Right.
demonstration purposes.
Now, Danielle will reply to me, and you can do it on the same piece of paper. Here's what you do. You cross out that arrow. You put the arrow towards me so I know it's going to me, or so I know it's coming to me, not to her, and she writes me the answer. Dear Lee, got you covered. Please check your email, Danielle. So let's talk about how this would happen, or what the intervening system is, and it would be like this. So when Danielle writes, or when I would write something like that, I would put that in Danielle's communication box. You know, a little thing of Staples. We talked about this a couple of years ago. Little thing of Staples. Everybody has their own little mailbox. It's in a central location where everybody can get it. So I'll write the dispatch. I'll put it in Danielle's box. Then Danielle will check your box. How often do you check your slot?
I check it all day long.
Yeah. Okay. So then she'll pull it out. And if she can read it right then and there, she will. Otherwise, it will go into her 3-basket system. And in the 3-basket system, you've got the inbox. So it's in. She hasn't opened it yet. Once she opens it and she isn't ready to act on it right away, she'll put it in the pending box. And the pending box is usually the biggest box that we have. We try not to get overflowing pending boxes because we don't want any communication to be backed up. If it stays in the pending box for a long time, somebody's requesting an answer, and well, I haven't gotten to it yet.
Right.
We've got to have enough time to get to it. And then once we've written the answer, we'll put it in the outbox, and it stays in the outbox only as long as it takes to get back to the communication center to put it in the other person's mailbox, so the other person can get it.
Right. Now, what these in, out, and pending boxes, well, for one, the communication center, the mail center, we have it in a central location in the practice, which is on the way to the restroom or by our water fountain, because people pass through there all day long. And the rule is that inbox needs to stay empty throughout the day. You're not allowed to clutter the inbox, your communication box, with stuff. So usually people are checking that all day long. They take that stuff from your communication center, you bring it back to your workstation. So clinical has workstations somewhere, front desk has desk stations. So when you come back to your desk, you just lay everything into your inbox, because maybe you have other things. You're talking to somebody, you're greeting a patient, you're checking any, whatever it is, you just lay everything in your inbox. When you're ready to sort through it, you sort through it. And the things that you can answer right away, you answer, you put it in your outbox. Things you can't go in your pending because you don't have the time, or you can't do it, or whatever it is. Usually that pending box is empty at the end of your day. If there's something left in that pending box, it's like a big project. It's an end of the week. It's an end of the month. It's something big. Usually our staff has a different filing system for long-term stuff, but usually that pending box is empty. The outbox purpose is so you don't have to keep getting up and going back to that communication center. When she gets back up again to go back to that communication center, she takes all of her out items and distributes to the other people's boxes as she needs to. Another rule is at the end of the day, before you go home, you can't leave open communication. You have to check your emails and get back to them. You have to check your communication box and make sure it's empty. You have to give people back that communication. That's staff and patients both. So if there's a phone call from a patient, call them back. At least call them back to say you got it and you're working on it. At least give a note back, say you got it, you're working on it. Don't leave that overhanging, because somebody really may need that piece of information before they can go on to something else. I know I'm like that. If you ask my girls, they'll tell you without a doubt, I'm always saying, check your email, check your box. I need it. I'm trying to manage 18 plus people a day. If I don't get that back,
It's not including me.
it's not including him. It's big for me. I need to keep going. And I can be more efficient and I can be much more effective if I keep getting back that communication, so I know everybody has received that. So I would recommend that you get that communication center in, as Dr. Sheldon said, Staples, very inexpensively. Get the box, get everybody's name on it. insert a policy of, if it's not urgent, if the patient's not in the office or on the phone, write the communication. Acknowledgments, big thing is acknowledgments. Give the note back, say okay, do whatever it says to do, and give it back to that person right away. Empty communication center by the end of the day. Use your in, out, and pending. Everything in until you can get to it, everything pending that you can't get to right now, everything out that you have completed. It makes the workplace so much more efficient. It reduces all the talk, all the chaos. It reduces it so much. Our girls actually love it. They feel like they're not stopped. They're not frustrated because like, what? They feel like they can keep going. So it makes everybody like each other that much better.
It's good. And that's, we talked about examples of why people are willing to do things. Samantha did something on Saturday. Jennifer called us on Sunday. Courtney made us
Right.
the beautiful book, and she did it after she put her daughter to bed. I mean, there are certain things that happen
Right.
as a result of efficiency and not having
Right.
things plugged up. And when there's unanswered communication or when there's interrupted communication, that's plugged up. You're plugged up here. And so it doesn't make for a good day. It sounds simple. A piece of paper and a way of filing the piece of paper just like the post office would. Just doing that, listen, it happened here when we first put it in.
Right.
And it'll happen for you too. Concentrate on written communication. In fact, we're in such a role. Guess what we're going to talk about next time? More written communication, other things that we're doing in our office
Yes.
in order to be able to make sure that things are done and they're done efficiently. This is the essence of management.
Right.
It works so.
Yes.
It works so spectacularly well.
This is the first step in getting the written communication inserted into your practice. Is the first step. It's a small step, but it's a very important step. So please take this for the next few weeks, get it inserted into the practice. And when you see us in 2 weeks, we'll go to the next level, which is an increased level of how to get this in there. It's a bigger project. So we'll work on that the next time we get together.
Very good. Are there any questions? I don't see any questions. Nothing. We're going to make this interactive session, but so far I don't see anybody. All right. I guess we accomplished everything. Thanks for joining us. We'll see you then.
Good night.
2 weeks. Bye-bye.
Yep.